Hi, are you Tammy?
Yes.
Okay, I'm Lauren Kovar. I'm going to be your student physical therapist assistant, and today I'm just going to go over and do some measurements to report your lack or progress of your range of motion in your ankle. So I see here that your diagnosis is a right ankle fracture and you got your cast removed about a month ago. Is that correct?
Yes.
Okay. So what is your pain today? Give me a resting number, like when you're laying on the couch or laying in bed, and when you are moving or doing some sort of activity.
It's 0 when I'm resting, and I'd say maybe a 3 when I'm moving around.
Okay. And with that 3, what do you have problems doing with in your daily activities?
Mostly just flexing my ankle.
Okay, can you give me an example of that?
Like maybe climbing the stairs. It's more stiff and I can't flex it very good.
Okay, anything else, or is that your main?
That's the main issue.
Okay. And any medications that you're on?
I just take ibuprofen as needed.
Okay. Okay, like I said, I'm going to do 3 measurements to report your lack or progress of your range of motion in your ankle. And yeah, I'm going to move you over to this table over here and we'll start.
Okay, sounds good.
All right, I have my patient sitting, and this is the best position to take ankle measurements in. I have her right ankle right here. Okay, so I'm starting my patient out in the sitting position as I showed earlier. I have her right foot right here, and the first measurement that we're going to be doing is ankle dorsiflexion. So to line this goniometer up, I'm going to have the axis point at her lateral malleolus. I'm going to have the stationary arm at the anterior midline of the lower leg using the fibular head as a reference right here. Then I'm going to have the moving arm coming to her 5th metatarsal. For the measurement, I am going to move the axis down a little farther just so I can be more in line with the 5th metatarsal right here. So how to do this motion, if this is your foot, you're just going to bring your toes up as high as you can. So whenever you're ready, bring your toes up for me. Okay, making sure that this stationary arm is still in line with that fibular head right here. Getting that in line with the 5th metatarsal. The reading is about 16 degrees right here, and the normal is 20. So while we were doing this motion, I was looking for the substitution of knee extension, excuse me. Knee extension is the substitution for dorsiflexion. Okay, so the first measurement I'm going to do is going to be ankle inversion. I'm going to start out with the goniometer on the anterior aspect of the anterior aspect between the malleoli. So it's going to be right here. The stationary arm is going to be the anterior midline of the lower leg using the tibial tuberosity as a reference. And then the moving arm is going to be on her 2nd metatarsal, or her 2nd toe right here. So I'm just going to have the patient move her toes inward. So if this was her foot, her toes are just going to go like that. Okay, I'm just going to make sure that this is aligned properly with her tibial tuberosity. It's in line with the malleoli right here. And there we go, in line with the with the 2nd metatarsal. So her measurement is about 33. And the normal for this motion is 35. And while I was measuring, I was looking for hip external rotation, which she didn't do. And then for the next, I'm gonna go ahead and write down that measurement real quick. Then for the next measurement, we have eversion, and it's the same landmarks as inversion. So we have the anterior aspect between both malleoli right here. We have the anterior midline of the lower leg using the tibial tuberosity as a reference. Then we have the same 2nd metatarsal right here that we're going to use. So the only difference with this motion is you're going to point your toes out You're gonna point your pinky toes out rather than in. Okay, so whenever you're ready. Okay. Is that as far out as you could go? Okay. All right, you can go ahead and rest. The norm for this measurement is 15. It looks like our patient is at 9 degrees right here. Okay, so while I was performing that measurement, I was looking for hip internal rotation, which the patient did not do. So those are my 3 measurements for today. Do you have any questions for me?
No.
Okay, and I'm gonna show these measurements to the PT, see if there is any progress or lack thereof, and we will send them off to your doctor. Okay, thank you.